Hey there. Today, we're going to walk through the essential information you need to know about a prescription medicine called Brukinsa. Our whole goal here is to break it down and make a pretty complex topic feel as straightforward as possible. So let's just dive right in. Look, we get it. Starting a new cancer treatment can feel like a lot to take in. That's why we're doing this, to break down the key patient information for Brukinsa piece by piece, so you can feel a little more prepared for those important conversations with your doctor.
All right, so first things first. What exactly is Brukinsa, and who is it for?
At its heart, Brukinsa is a type of targeted therapy. It's a prescription medicine made to treat very specific kinds of cancer in adults. So it's not chemotherapy in the way most people think of it. Instead, it's a drug that's designed to work on specific pathways that help cancer cells grow and survive. So what cancers are we talking about? Well, Brukinsa is approved for adults with several specific blood cancers. These include mantle cell lymphoma, Waldenstrom's macroglobulinemia, and marginal zone lymphoma. It's also used for chronic lymphocytic leukemia, or CLL, and small lymphocytic leukemia, SLL. And for follicular lymphoma, it's used together with another medicine called obinutuzumab. It's also worth noting that for some of these, it's prescribed after a patient has already tried other treatments. Okay, let's move on to a really crucial phase, the conversation you need to have with your doctor before you take a single dose. This is all about making sure this treatment is as safe as it can be for you personally. Now, this might sound like a no-brainer, but it is the absolute foundation for your treatment. Your doctor needs the whole picture of your health to see any potential issues coming. Seriously, no detail is too small when you're talking about your medical history. First up, bleeding risks and any surgeries you might have planned. Brukinsa can affect bleeding, so it's super important for your doctor to know if you've had bleeding problems in the past. Also, if you have any kind of surgery coming up, and yep, this includes dental work, your doctor will most likely have you stop taking Brukinsa for a little while, just to be safe. And the conversation keeps going. You'll need to talk about your wider health history. For example, are you fighting off an infection right now? Do you have a history of an irregular heartbeat or high blood pressure? And this is a big one, any liver problems at all, including if you've ever had hepatitis B. All of these things can really change how your body handles this medication. Now, we need to pause and really focus on a very important warning. For anyone who is pregnant, might become pregnant, or is breastfeeding, you need to have a very serious talk with your doctor. And here's why. Brukinsa can cause harm to an unborn baby. Because of that risk, there are some very specific safety rules. For women who can become pregnant, it's required that you use effective birth control while you're on the treatment and for at least 1 week after your last dose. And hey, this applies to men too. If you have a female partner who could get pregnant, you need to use contraception. On top of that, you shouldn't breastfeed during treatment or for 2 weeks after your final dose. And the last part of this pre-treatment chat is making a full list of everything else you take. And I do mean everything. It's not just about your other prescriptions. We're talking over-the-counter stuff, vitamins, even herbal supplements. Some of those can actually interact with Brukinsa, and you don't want that. Okay, so you've had the talk with your doctor, and everyone's decided to move forward. So now let's get into the practical side of it. What does the daily routine of taking this medicine actually look like? The instructions are actually pretty simple. First, and this is the golden rule, take it exactly how your doctor prescribed it. Don't ever change the dose yourself. You're going to swallow the capsules or tablets whole with a glass of water, so no opening them, chewing them, or crushing them. The nice part is you can take it with or without food, so that gives you some flexibility. And if you happen to forget a dose, no big deal. Just take it as soon as you remember on that same day and then go back to your normal schedule the next day. We're now moving into what is, honestly, the most important section for your safety from day to day. Understanding what to look for when it comes to potential side effects. Let's just talk about side effects. The point of this isn't to scare you, it's to empower you. Knowing what to look for is the single best way you can be a partner with your healthcare team and help keep yourself safe during treatment. Bleeding problems, which doctors call hemorrhage, are a common and potentially serious side effect. You've got to be on the lookout for signs like blood in your stool, which might make it look black and tarry, or if your urine looks pink or brown. You also want to watch for any unexpected bleeding that's severe, if you're coughing up blood, or if you start bruising way more easily. Even feeling dizzy, weak, or confused can be a sign. Any of these, you call your doctor right away. So beyond bleeding, there are a few other serious things to know about. Infections can get serious fast, so any fever, chills, or flu-like symptoms, that's a call to your doctor.
There is also a risk of developing a new second cancer, like skin cancer. That's why your doctor will keep an eye on you and why it's so important to use sun protection. And finally, watch for signs of liver problems, like pain in your stomach, dark-colored urine, or if your skin or eyes start to look yellow.
Heart rhythm problems are another serious possibility. You need to be alert for things like a fast or irregular heartbeat, feeling dizzy or lightheaded, actually fainting, becoming short of breath, or having any kind of discomfort in your chest. These are definitely not things you want to wait on. You contact your healthcare provider immediately if you experience any of them.
So it helps to know what needs an urgent call now response versus what can wait for your next appointment. Those really serious side effects we just covered, like signs of bleeding, infection, or heart rhythm changes, those require an immediate call to your doctor. But on the other hand, there are more common side effects, like your blood counts being a bit low, having cold-like symptoms, or some muscle pain. Those are definitely important to talk about, but you can usually bring them up at your next visit.
All right, let's wrap this up with just a few final but really important points about managing your treatment for the long haul. Storing your medicine correctly is a huge part of safety. You want to keep Brukinsa at room temperature and always in its original child-resistant bottle. And of course, just like with all medicines, keep it safely away from kids. And here's a critical one. This medication was prescribed for you. You should never, ever share it with anyone else. You know, the biggest takeaway here is that all this information is really a tool to help you build a partnership. It's not supposed to replace your doctor. It's meant to help you have smarter, more productive conversations so you can make the best health decisions together as a team. And that leads right into the most important disclaimer of all. What we've gone through here is a guide. It is absolutely not, and it can never be, a substitute for getting professional medical advice from your own doctor or healthcare provider. So, what's the final, number one, most crucial point? It's just this. For any question, any concern, any little change you notice, always talk to your healthcare provider. They are your best and most important resource on this journey.